Hello doctor, I am interested in being started on an ionotrope or vasoconstrictor medication.
Well son, please tell me why you would like to be started on one of these medications.
Well doll, you see I am visiting my father. He does look young for his age. He is your patient lying in front of you now and appropriately dressed. He was started on dopamine, an epinephrine. He nearly died and now he is alive. If it could do that for him, I can only imagine what this radical medication could do for me.
I would like to hear a little bit more about your father. I take care of many patients in a day, so I cannot differentiate him from Adam.
My father's name is not Adam, it is William. He was brought to the hospital because he was having very severe chest pain. You placed a stent in his heart, but he was still very sick afterwards. His heart was very weak. You told me that he nearly died. The dopamine and epinephrine saved his life. See what I mean? I would love me some dopamine doll.
Well, it does appear that your father suffered from cardiogenic shock after his heart attack. That would explain why he was started on the dopamine and epinephrine.
I do not think that he was in shock. He never even looked surprised or scared.
Please bear with me. This is a different type of shock. Shock means that oxygen was not traveling appropriately to his body. He was started on these medications because he was hypotensive. This means that he had a low blood pressure. These medications help squeeze the heart and make it beat stronger. Without them, his organs would not have received enough oxygen. Bingo.
See why I want to get me some? These medications seem to be all good.
Well son, they are not all good. These medications can increase the workload of the heart. People that take these medications can experience tachycardia, otherwise known as a high heart rate and cardiac dysrhythmias. Also, you would need an IV placed in order to receive these medications. Nurses would also have to monitor your vital signs very frequently. Oftentimes you would even need to be in an intensive care unit.
Well, an intravenous line is not so bad. I would be willing to stay in an intensive care unit.
The medications can be very harsh if they get outside of your tissue and into your skin. They are called vesicants. They can destroy tissue. If that happens, then we would have to inject a medication called Regitine into the surrounding skin to allow more blood flow to the tissue. Some necrosis or tissue death could still occur. They should only be used for individuals that need them. We do not need you to take up a valuable intensive care unit bed.
How do you know that I am not in cardiogenic shock? I still want dopamine, epinephrine, dobutamine or norepinephrine.
I know that you are not in cardiogenic shock because you are pink, your blood pressure is adequate and I could palpate your pedal pulses. You did not have a heart attack. I also know that you are making good urine output because your mother told me that you wet the bed at night and still have occasional accidents during the day.
So why did my dad need these medications?
Your dad was in cardiogenic shock. He had a pulmonary artery catheter in place. It showed that his pulmonary artery pressures were high, his central venous pressure was high, his blood pressure was low and that his heart was pumping very poorly. He had a low cardiac index. Without these medications, he would have had fluid back up into his lungs and he would have had massive swelling. He could have died without the medications.
So are there any complications with using these squeezing medications?
Yes. 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 Please listen to me. These medications increase blood pressure. They increase heart rate. They increase the workload of the heart. They can lead to dysrhythmias. They often require invasive lines in order to administer them safely and those can lead to complications. If the medications get outside of the blood vessels, they can lead to tissue death.
So are you going to get me some dopamine or another ionotrope, or what?
No, son. You clearly do not need them. The only thing that you need is a comb or a brush for your hair.
Well, if you are not going to get me a squeezing medication, Then how about a vasoconstrictor medication like vasopressin or neosynephrine?
No. 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 These medications are also used to treat low blood pressure. They also lead to an increased workload of the heart and can lead to dysrhythmias. Once again, you do not have an issue with your blood pressure.
So who benefits from the vasoconstrictors?
Finally, a good question. Individuals that have a low blood pressure, but have adequate fluids in their blood vessels. Their pulmonary artery pressures will be high and central venous pressures will be high, but they will have a decreased afterload. Their systemic vascular resistance would be low. Typically, they are given to individuals that have normal cardiac outputs because constrictors like vasopressin and neosynephrine can decrease cardiac output. Individuals with decent heart function are often given fluid boluses prior to starting these medications.
Heavy stuff, doctor. So will you prescribe me a vasoconstrictor? Vasopressin sounds fantastic.
No, son. You are on your own.
In that case, bye da.
Adios.